Hi everyone, my name is Yola. I'm a naturopathic doctor, and today's Wellness Wednesday video, I'm going to talk about Lyme disease. So Lyme disease right now, it's in the media because it is the season for exposure to it. And we've had a lot of friends, a lot of family members and patients ask us about it. So I'd like to go over what Lyme disease is. I'm going to talk about why it's important to treat early and detect it early, and even ways of preventing it. So number one, Lyme disease is a disease that is spread by a spirochete type of bacteria, and it's given or kind of contracted through bites from deer ticks. So anytime that we're outside in the woods, or even, I have to say, even in our yards, we have some potential exposure. So with this disease, it is a multi-system, multi-symptomatic disease. So it includes a lot of different symptoms. The first symptom is what's classically known as a bullseye rash. So it literally looks like a red circular rash with a clear center. Other symptoms could kind of expand into other parts of the body. So it can include fever, chills, flu-like symptoms. It can also spread to incorporate joint pain, and then even affect one's cognition and lead to issues such as brain fog, memory loss, and difficulty remembering words. So it's a very multi-system disease. So that is why it's so important to, number one, detect it early and then treat it early. The spirochete kind of grows at a very slow rate. So because it does that, the symptoms can also develop at a really slow rate, and that's why it's so difficult to identify. So that first symptom of the bullseye rash is key in knowing if somebody has been bitten by the deer tick. So the next key would be that flu-like symptom, and particularly if we're having flu-like symptoms in the spring or summer, which is not a time of year for the flu. So if somebody has flu-like symptoms, then my alarm bells are going and I'm wondering, okay, what's happening here? So those are the symptoms, and then it can progress into chronic Lyme issues. So again, we want to treat and detect early, okay? How to diagnose it, other than recognizing the bullseye rash, is to do a tick check. So after we've been outside, it's kind of important to take a look and see if there are ticks on our body. Wearing white clothing really helps identify ticks because they'll stand out more, and it even helps prevent them from attracting to us. So white clothing is important when we're in the woods or outdoors, okay? Next, we want to diagnose it with either a Western blot or the Lyme Titer, and a lot of medical doctors will either do one or the other, like start with the Lyme Titer and then move on to the Western blot. It is imperative, in my opinion, to actually do both tests because you will have a much stronger diagnosis, or at least have a stronger way of ruling out this disease. So that's the diagnosis. So now what do we do to treat? This is an area in which antibiotics are absolutely necessary. I would not only rely on naturopathic medicine to treat Lyme disease. I would recommend antibiotics, and you all know that I'm not a huge fan of antibiotics unless absolutely necessary. But to support that, naturopathic medicine comes into play. So this is where we support gut health. We help prevent complications from antibiotic use, and we also support liver health and the other systems that could be problematic with this disease. So contact a naturopath certainly for that supportive role, okay? And the last thing I want to mention in terms of prevention, other than white clothing and doing the tick check, it is effective to use certain essential oils that will deter the tick from actually even coming onto our body. So strong aromatic essential oils such as thyme, citronella, lemongrass, and eucalyptus has been shown to be effective deterrents. So we can use that for preventing mosquito bites, but we can also use that to prevent tick bites. So I hope you found all of this information helpful. I know it was a mouthful, but number one, make sure with Lyme disease we're doing the things that we can to prevent it. Number two, we're looking out for early diagnosis and treating right away. And then thirdly, we're supporting naturopathically because the treatment is quite aggressive and may be long. Okay, so I hope everyone has a really healthy and happy time outdoors, but just be mindful that we want to prevent this disease. Thank you.